7 signs your body is calling for help after the age of 60. Number 5 that everyone often ignores. Have you ever had a strange little symptom, maybe a cramp, a dizzy spell, a sudden craving, and just brushed it off? It's nothing. Just getting older. What if I told you it might be something? Welcome back to Elderly Voices. I'm Dr. Eric Bergman, and today I want to share something urgent but empowering with you. After age 60, our bodies speak more softly but more often. They don't scream the way they did when we were young. Instead, they whisper. And if you're not paying attention, you might miss a critical call for help. In this story, we'll uncover 7 subtle signs your body might be in distress, what each sign really means, and how to respond early before it becomes a full-blown health issue. Backhand index pointing right, especially stay tuned for number 5. It's the one I see ignored the most, even though it often leads to life-altering complications. Let's begin. Let's listen together. 1. Persistent fatigue, not just getting old. I sleep 8 hours, but I still wake up tired. That's what Elaine, 74, told me last fall. She'd always been active, walking her dog, gardening, even helping out at her church. But over the course of 3 months, her energy vanished. She needed naps after lunch. She felt drained just doing laundry. And she chalked it up to age. Until her daughter insisted on a checkup, and we found dangerously low iron levels. Round pushpin what it could mean. Chronic fatigue isn't just a sign of slowing down. It can be your body flagging. Anemia, low red blood cells. Hypothyroidism. Sleep apnea. Heart disease. Chronic inflammation or autoimmune conditions. Green circle what to do. Start with a full blood panel. Keep a fatigue diary. Note when energy dips, how long naps last, and if symptoms worsen after eating. Sometimes, fatigue is the only symptom before something more serious appears. I thought I was just tired of life. Turns out, my body was running on empty. Elaine, 74. 2. Sudden weight loss or gain without trying. John, 69, was thrilled when he dropped 15 pounds. Must be the cleaner eating, he said. But he hadn't changed his diet. And he wasn't trying to lose weight. Within 3 months, he was pale, weak, and losing muscle. Tests revealed early-stage pancreatic cancer. Round pushpin what it could mean. Weight loss can signal cancer, thyroid issues, diabetes, or digestive malabsorption. Weight gain, especially around the abdomen, can point to congestive heart failure, liver disease, or hormonal imbalances. Green circle what to do. Don't assume it's just the aging metabolism. Track your weight weekly. Pay attention to sudden changes in appetite, taste, or bathroom habits. See your doctor if changes persist for more than 3 weeks. My body knew something was wrong long before I did. John, 69. 3. Frequent dizziness or balance issues. I just stood up too fast. That's what we all say, until a fall breaks a hip. Balance issues are not just clumsy moments. They are messages from your brain, ears, heart, or nerves. Round pushpin what it could mean. Inner ear dysfunction, vestibular system, low blood pressure or heart irregularities. Vitamin B12 deficiency. Early neurological signs, e.g., Parkinson's, small strokes. Green circle what to do. Do a 30-second stand test at home. Stand on 1 foot with eyes open. Time how long before you lose balance. Anything under 10 seconds may warrant a further evaluation. It was a tiny fall, but it led to a big realization. My body's balance system was breaking down quietly. Marjorie, 76. 4. Chronic constipation or changes in bowel habits. This is the conversation no one wants to have, but needs to. When Robert, 73, started experiencing occasional blood in his stool, he dismissed it. Hemorrhoids, he said. It wasn't. It was a stage 2 colon tumor. Round pushpin what it could mean. Constipation could signal dehydration, medication side effects, or slowing intestinal muscles. Persistent changes, alternating diarrhea/constipation, blood, ribbon-like stools, can be signs of colorectal disease or serious inflammation. Green circle what to do. Track your bowel movements. Look for changes in frequency, shape, color, and ease. Don't be afraid to talk to your doctor. A colonoscopy, as awkward as it sounds, could save your life. Ignoring my gut nearly cost me my life. It's not a topic we like, but it's a topic that matters. Robert, 73. 5. Loss of interest in things you once loved, the silent signal everyone ignores. This one is deeply personal. After my wife passed, I stopped tending to my garden. I stopped listening to music. I even stopped cooking, something that had always brought me joy. I didn't feel sad. I just felt nothing. And I told myself, you're just tired. You're older now. But I wasn't just tired, I was depressed. Round pushpin what it could mean. This emotional numbness or apathy often signals clinical depression, grief stagnation, hormonal shifts, early cognitive decline, social withdrawal syndrome. Green circle what to do. Ask yourself, when was the last time I felt joy? If you can't remember, please talk to someone. Depression in older adults is common, but not normal. And most importantly, it's treatable. It wasn't sadness. It was emptiness. And it was the most dangerous thing I ever ignored. Dr. Bergman. 6. Shortness of breath, especially when at rest. Dorothy, 68, couldn't understand why walking across her living room left her breathless. I thought I was just out of shape, she told me. But further testing showed her heart was struggling to pump effectively. Round pushpin what it could mean. Chronic obstructive pulmonary disease, COPD. Heart failure. Pulmonary embolism, blood clots. Severe anemia. Green circle what to do. Take note of when the breathlessness happens, after meals, at rest, climbing stairs. Record your oxygen saturation with a fingertip pulse oximeter. Anything consistently below 92% should be evaluated. I wasn't just winded, I was being warned. Dorothy, 68. 7. Swelling in ankles, feet, or hands. Mild swelling can seem innocent, but persistent swelling, especially at the end of the day, is often a clue that your body is struggling to circulate, filter, or balance fluids. Round pushpin what it could mean. Heart valve disease, kidney issues, liver dysfunction, lymphatic drainage problems. Side effect of medications, especially calcium channel blockers. Green circle what to do. Track swelling patterns. Press your thumb into your ankle. If it leaves a dent that lasts more than 10 seconds, it's time to call your doctor. I thought it was just my socks. But the swelling was my heart struggling, softly, silently, to keep up. Carlos, 71. These signs don't always mean disaster, but they always mean awareness. The earlier we notice the whispers, the less likely we'll face the screams. Your body is wise. It wants to live, but it needs you to listen. If your body could talk, what would it say? Would it whisper, "Thank you for noticing"? Or would it sigh, "Please hear me before it's too late"? After age 60, the truth is simple but powerful. Your body doesn't just age. It communicates. Every little pain, twinge, or subtle change is a conversation starter. But so many of us were taught to ignore it, to be tough, to wait until things get worse, to say, "I'm fine," when something inside just knows we're not. Let me tell you this, you have every right to speak up, to check in, to investigate, not because you're weak, but because you're wise. Your body is not failing you. It's fighting for you. Every symptom is its way of protecting you, but it can only help you if you listen. So take that next step. Make the appointment. Ask the awkward question. Bring up the weird symptom. Talk to someone you trust. Because the strongest thing you can do after 60 isn't to ignore pain. It's to honor the messages your body sends you. Let me ask you, small blue diamond, which of these 7 signs surprised you the most? Small blue diamond, have you felt one recently, but brushed it off? Speech balloon, share in the comments below. Your voice matters more than you know. You may just give someone else the courage to listen to their body too. I'm Dr. Eric Bergman, and this is Elderly Voices. Thank you for showing up for yourself today. Until next time, stay aware, stay strong, and stay alive to the wisdom within you.